Hello guys, welcome to my channel Praveen Darwari. So today we'll discuss microbiology. So the main thing why I'm doing this video is that I have been searching a lot of resources and I try to put all of them together, and I'm no smart guy, but I'm also a student like you. But then I thought it would help you where you could get all information at one place, and which would be easier because all the high yield topics will be covered here and you could just be looking at these videos. So I'll try to make them shorter, and then each topic wise, so you can just watch them whenever you want. And we'll start with microbiology, and I'm also a student and I'm also learning. It will keep me revising. It will help me revise the stuff I know, and it also gives me an opportunity for people who are trying to learn to make their learning easier. I would be happy if it be useful for someone. So please do watch. If it will be useful for you, I'll be glad. So let's start with microbiology. And talking about microbiology, the basic microbiology you need to know is general microbiology. General microbiology is where we cover staining of organisms, or the culture of organisms, so the medias of which where the organisms grow, and then safety, all this stuff. We'll talk about general microbiology at the end. And then the biggest important of microbiology, whichever exam you're writing, is bacteriology. We'll start with this one first, and then there is virology in microbiology, and virology covers all the viruses including double-stranded RNA, DNA, single-stranded, envelope, non-envelope. We'll discuss that and the topics associated with it during this course of videos in microbiology. And then we have fungi, and with the fungal infections, this is a shorter topic and the easier topic, and we see questions coming from fungi topic always, 1 or 2 in USMLE and 1 or 2 in FMG, NEET PG. So if we can cover fungi, we can answer 1 to 2 questions in any examinations we're about to write. And then we have parasital infections, and with parasital infections are becoming very high yield topics nowadays. So it's very important to all focus on parasital infections too. But the first thing is we start with bacteriology. So let's start with bacteriology first. And today in this video, we'll try to cover gram positive cocci. So before we start on gram positive cocci, I want you to know about gram staining first. Normally I wanted to discuss staining in the general microbiology videos, but then first we need to know about gram staining, because so you would know what we are going to learn today is gram positive cocci. So gram staining is usually a technique that is done to visualize the bacteria, and based on the gram staining we divide them into gram positive and gram negative organism. So for the gram staining we use a mnemonic which is famous, which is methyl gas. So what we do here is we remember them as methyl violet for methyl, and G for grams iodine, and grams iodine is the mordant, and acetone is the fixer of the stain, and S is for sulfurin, and acetone is decolorizer, and sulfurin is counter stain. So this is about gram staining. If they ask what's the moderator for gram staining, you should know is grams iodine, and what's decolorizer is acetone, and sulfurin is counter stain of gram staining. So how do we know that gram positive, if an organism is gram positive or gram negative? So in gram positive organisms, the staining becomes purple to violet, and in gram negative organisms we see pink color organism. So after stain, if you see a bacteria which is purple or violet, then you need to know that the bacteria is gram positive. That means it's stained gram staining. And after gram staining, if organism is pink, then it's gram negative organism. So that's about gram staining. So let's discuss about the gram positive organisms, the organisms which turn purple after gram staining. So first things first, gram positive organisms. So one thing all of you should remember is gram positive organisms, all of the cocci are gram positive. So if you see any cocci, it's gram positive. And there are some rods or bacilli which are gram positive, because most of the bacilli are gram negative. We'll talk about them in the next videos. And now about the organisms which are cocci and gram negative. Cocci which are gram negative are meningo and gonococci. We'll discuss them in gram negative organisms, but for today we are discussing about gram positive organisms. So for the gram positive cocci, the most important organisms are Staphylococcus and Streptococcus. Now Staphylococcus is catalase positive. Coagulase test is further done to differentiate, and streptococci is catalase negative organisms. So this is very important. So what is the test that is done to differentiate between staph and strep? Is catalase test. And if an organism is catalase positive, then you should know is staph, and if it is catalase negative, then you should know is streptococcus. Sometimes if you see a big STEM question, but then the bottom line says the organism is catalase positive and the options are given streptococcus, then you can immediately rule streptococcus, because you can rule out streptococcus because you know catalase positive organism is staph. So these are some of the key points that can make you answer questions in an easier way and won't let you consume most of your time. So let's talk about staph today in this video, because I don't want the videos to be longer, so you can't be watching whole videos too long. So we'll discuss organism by organism, so that would make easier learning for you. So the first thing we do is learn about staph today in this video, and tomorrow we can learn about streptococci. With the staph, we differentiate based on catalase, and staph is catalase. So I said staph is catalase positive organisms, and then further coagulase testing is done. So they are coagulase positive staphylococcus organisms, which is the most important. Staph aureus, many questions are seen on staph aureus. And then there is coagulase negative staph organisms, which are further divided based on antibiotic testing of novobicin. Now there are organisms which are novobicin sensitive and which are not sensitive. For the sensitive organisms are staph epidermidis. It's also another important because questions will be coming on that. And then there is staph saprophyticus. Now we'll discuss about coagulase positive and catalase positive staph. You see, sometimes question can come and then the easy clue will be given: the organism is catalase positive, coagulase positive. So you don't need to think much about the case that is given. The only organism that is catalase positive and coagulase positive is Staph aureus. Okay. One thing I want you to know is about exotoxin and endotoxin. Before we discuss about Staph aureus, I just wanted to remind you of this. So most of the exotoxins are produced by gram positive and gram negative organisms, but the most important thing is endotoxin is only produced by gram negative organisms. So this is very important, because these gram negative organisms only produce endotoxin. And what endotoxin is consists of is lipid A, which I'll be discussing in gram negative organism videos. But for today, so let's continue Staph aureus. So in Staph aureus, in Latin, aura means golden yellow pigment. And for Staph aureus, the virulence factor of Staph aureus is protein A. So what is virulence factor? Virulence factor is how the bacteria is, expressing or producing the infection in the organism that it is affecting. So Staph aureus uses protein A. Protein A, what it does is it binds to Fc region of IgG, Fc region of immunoglobulin G. By binding, what it does, it prevents opsonization, recognition of bacteria, and phagocytosis further. So the virulence factor that Staph is expressing is protein A, and protein A, what it does, it binds to Fc region of IgG, which prevents opsonization and phagocytosis of Staph aureus. That's how virulence of Staph aureus is expressed. Further talking about Staph aureus, the thing you need to remember is clusters. Whenever you see cluster grape image, then you need to know is Staph aureus. This cocci is that nothing but circular. So whenever there's grape like clusters of this cocci, then you need to know is Staph aureus. And is gram positive organism, catalase positive organism, and is coagulase positive organism. The virulence factor is protein A. You need to know that. So now, how is Staph important clinically is very important. So what does Staph causes? First thing you need to know is where does Staph colonize commonly. So Staph commonly colonize in nares, ears, and groin. And it can cause inflammatory diseases such as infective endocarditis, septic arthritis. Septic arthritis is nothing but bacterial arthritis, pain in joints because of bacterial infections, and then osteomyelitis. These are some of the infections caused by Staph aureus. And then there is toxin mediated disease, which is toxin shock syndrome. So what happens here is scaled skin syndrome is seen. So for the scaled skin syndrome, I want you to Google the photo right now so you can know how the image of scaled skin syndrome looks like, because I don't have an option to show you how scaled skin syndrome looks like because it will be subjected to copyright. But then I want you to check it now on Google so you can remember it whenever you are thinking about Staph aureus. And then there are type of toxins, because type A enterotoxin causes non-bloody diarrhea after ingestion of food, which is after 2 to 6 hours mostly. So whenever you eat food and after 2 to 6 hours you have non-bloody diarrhea, because bloody diarrhea is entirely different. It's dysentery and other organisms cause it, and we are not discussing that. Whenever it's non-bloody diarrhea and after 2 to 6 hours of food ingestion is because of Staph aureus type A enterotoxin. So what happens now, another important high topic here with Staph aureus is if there is prolonged tampon usage in female or prolonged nasal packaging. If a patient presents with prolonged tampon and usage or prolonged nasal packaging, and then the patient is presented with increased liver enzyme levels of increased AST, ALT, alanine transferase is increased, and then the bilirubin level is also increased. The patient has also rash, he has end organ failure and diarrhea, the first thing you need to think about is staphylococcal toxic shock syndrome, and the type F toxin is causing this. Important thing I want you to know about Staph aureus is Staph aureus shows beta hemolysis on blood agar, which is very important. And post influenza, if a patient comes with post influenza, like he had influenza and then he's recovering from it, but then pneumonia is seen in this patient, the most common cause of post influenza pneumonia is Staph aureus. You need to also remember this. This is a very high yield topic, very high yield question in various examinations. And now we need to know about MRSA staph. So what is MRSA staph? Is methicillin resistant Staph aureus. And how is this resistance transferred is, I'm sure all of you know, was a bacteriophage. So the phage that is commonly used for transfer of this resistance is 8081A bacteriophage. This is the most common phage. So this is how the phage comes. It's transporting resistance in Staph aureus. So you need to know this is very important. Why you need to know about MRSA staph is because MRSA staph causes community acquired infections which are very serious in healthcare. And so to summarize this is about all you need to know about staph. I'm sure if you know about these topics that I mentioned here, or these points I mentioned here, you'd be answering most of the questions about Staph aureus. And that's it about Staph aureus. Let's discuss about gram positive organisms which are novobicin sensitive, which is Staph epidermiditis, which is our next organism. So let's discuss about Staph epidermiditis. So basically Staph epidermiditis, you can say it is catalase positive, coagulase negative organism, because coagulase negative is coagulase positive is Staph aureus, and coagulase negative is our Staph epidermiditis, but it's novobicin positive. And it does not ferment mannitol. That's one thing I want you to know, because Staph aureus ferments mannitol. So this feature differentiates from both of them. So why is Staph epidermiditis so important for us clinically is it is present normally in our skin, and whenever a blood culture is performed, it contaminates the blood culture. And the most important question, or the high yield question regarding Staph epidermiditis is it infects prosthetic devices. So whenever a person has come with an prosthetic device, which could be a heart valve, or let's say a catheter is placed, an IV catheter, or a biofilm is formed because of IV catheter, and these organisms infects these prosthetic devices and causes endocarditis. So that's why Staph epidermiditis is an organism that causes in prosthetic. So whenever you think about a prosthetic device and then an infection is happening, then you need to know is Staph epidermiditis. Is as simple as that. That's the most important thing about Staph epidermiditis. So let's talk about Staph saprophyticus. So talking about Staph saprophyticus is very short. Staph saprophyticus is novobicin non-sensitive organism. So if the question says there's an organism which is not sensitive to novobicin, which is coagulase negative, but then it is catalase positive, then the first thing you need to know was Staph saprophyticus. So what are the clues that can you see in a clinical case to know is Staph saprophyticus is? It is normally, it causes UTIs in females of reproductive age. But you know what's the most common organism that causes UTIs in female is E. So the most common organism that causes UTIs in females is E. coli, which is very, very important, because some questions, sometimes examiners just want to test your basic knowledge. They can give an reproductive age female of 22 years old and she's having some infection which is UTI, and they'll just ask, give some clues about the tests that are performed for E. coli, if this is nitrites positive, urease positive, and then you need to know that it's E. coli with the clues that are given, because the most common UTI causing organism in females is E. coli. But then if they have given UTI kind of symptoms, but they have given novobicin testing and catalase testing and coagulase testing, with all that, then you need to know the second most common organism is Staph saprophyticus, and that's what you need to be answering. I hope this video was helpful regarding Staph organisms, and in the next video we'll be discussing about strep. Forgive me if I made any mistakes, because I'm also starting this series to learn, also to teach, and also to help. So if you can add more points in comments, I'd be grateful, and suggestions are also helpful. And thank you for watching.